Hi there, my name is Danielle Nall. I work with the Vascular Access team here at Trinity Health Oakland. I'm here today to show you how to do proper dressing placement for all peripheral IVs, applying and removing, as this is going to be very important in patient care for preventing infection. So first, I'm going to walk into the patient's room. I'm going to introduce myself, and as I see, the patient does have an anacubital IV. Our policy here at Trinity Health Oakland is to remove any peripheral IVs in the anacubital within 24 hours, okay? So we're gonna start with this first. I'm gonna wash my hands. So I'm gonna grab my gloves. I've washed my hands and I've gathered my supplies. So there's an IV sterile dressing change kit. Okay, this will have your tourniquet. There's also transport tape in there. Some patients prefer paper, so just know your patient population. There's a piece of gauze. There's a chloroprop also in here. I have my Tegaderm dressing. I have the J-loop, a flush, my IV catheter, my swab cap, and then also we're going to want to date the dressing too. Okay, and now I have my dressing change date. It's ready to go. As you can see, I dated it for today, 4/11/24. I put my time and I also put the initials. This is very important, as per our policy, you should be changing the dressing every 96 hours or as needed, okay? So if there's blood at the insertion site, you should change before the 96 hours. Okay, so that is ready to go. We also change the tubing every 96 hours too, okay, or as needed. So in this situation, the patient has an anacubital IV. Again, this has to be removed. It's been 24 hours, so I'm going to find a different insertion site for my patient. I also see that there's Coband on this patient. This is also not allowed. It's per our policy. We do not use Coband on IVs. So at this time, we're going to remove the IV. We do use the low and slow technique, okay? So you're going to start at the bottom of the dressing, okay? And we're going to kind of break away at the bottom of the wings of the dressing. Sometimes you may have to use a little bit of alcohol to help with the removal. I find with transparent dressings that usually that is not needed. The most important part of removing the dressing though is using your non-dominant hand and holding the hub of the catheter during removal. So I'm going to remove the securing strip at the hub, again, with my non-dominant hand holding the hub of the catheter. Okay. Okay. I'm going to hold with a piece of gauze. I'm going to remove the IV. I'm going to hold pressure at the site. Okay, and then okay, I'm going to hold pressure. At this time, after removal, you should chloroprep the site for at least 30 seconds, then allow to dry, okay? And replace with gauze and a piece of tape, again, patient preference.
What you looking for?
Nothing. Okay, so at this time, we're going to start a new IV. We're going to set our supplies up. And make sure you have a clean surface, okay? Please don't use the patient's bed. Please use the table and make sure it's clean. When you're removing the dressing from the package, keep it in the package. Keep the J-loop in the package also. You're going to want to prime your tubing. Again, keep the J-loop in the package. Don't remove the plastic tip on the J-loop. And then I have my swab cap also. Okay, so at this time, you're gonna apply your tourniquet. Okay. All right. The forearm is the preferable site for starting IVs. So at this time, we're going to start our IV right here. I have a ChloraPrep. Most importantly, you're going to clean for at least 30 seconds at the insertion site. Okay, it has been 30 seconds. And then allow to air dry for at least 1 minute. This is very important. You're going to prevent infection and also prevent any reactions on patients who have sensitive skin. Okay. And no waving at the site, just allow to air dry. All right. Okay, it is dry. With your Tegaderm, you're going to want to remove, these are sterile strips, okay? These are kind of securing devices, what I call them. You're gonna wanna, there, and just leave your Tegaderm right here. Do not touch around the Tegaderm, just leave it right there, ready to go. Okay, you're gonna wanna anchor the skin down. Okay, and at this time, insert the IV. Okay, I have flash. And at this time, I'm gonna advance my catheter. Okay, I'm gonna hold some pressure here at the site. Sometimes I also put a little bit of gauze underneath too. This is preference. Retract your needle. As you can see, my plastic step is still on the J-loop. This time I'm going to remove it. I'm going to attach to the IV catheter. I'm going to tighten here at the site. It is important to aspirate first. I'm going to pop my tourniquet now at this time also. Aspirate first, then flush. Aspirating first is important as you want to make sure you are in the vessel. Okay? Perfect. This time I can deattach. Okay. All right. So these are the sterile securing strips. I'm going to take one securement strip and I'm going to apply to the hub of the catheter. This will secure your IV in place. Next, I'm going to take the Tegaderm. Again, this is the no touch technique. By just touching the top of the dressing. So again, no touch technique, don't touch the side of the dressing. And I'm going to place the IV window of the transparent window over the hub of the catheter. And at this time, I'm also going to kind of slightly overlap the bottom of the dressing. I do that for two reasonings. One, it also secures your catheter to help prevent infection. And second reasoning is that it creates a barrier between the patient's skin and the hub of the catheter and prevents any pressure injuries. I'm then going to remove the paper tape around the transparent dressing. And as I'm doing that, I'm going to tightly secure. It kind of creates an adhesive barrier to the patient's skin, okay? And then lastly, there's one more securement strip. And I'm going to put this over the hub of the catheter. Okay, these dressing kits I spoke about earlier, they come with tape, but again, it's patient's preference. Some patients prefer paper tape. At this time, I'm going to just use what is provided in the kit. Instead of having the J-loop dangling down, this prevents your IV from coming out. It secures it in place. And then I'm going to apply a swab cap, or if I'm going to hook my patient up, I'm going to get new IV tubing at this time with my new IV start. Okay. I have already primed my IV tubing, and I'm going to connect at this time. If I was not connecting, I would just apply the swab cap. Okay, next we're going to also put the date on the dressing. I already labeled this prior to the IV insertion, so we're ready to go. Okay, at this time I have my dressing dated. I also knew I had to change my tubing at this time. So I dated it the same, 4/11/24 is my dressing, along with the same time and my initials. And I'm going to apply to the tubing. So at this time, the most important part is making sure that all IV dressings and tubing are changed every 96 hours or as frequently needed. So if your patient's, if the dressing is lifting up, the site looks bloody, you would want to change that sooner, okay? Okay, anytime these are disconnected from the J-loop, the primary tubing, or piggyback tubing, you will need to replace the tubing to prevent infection.